So here I am once again in front of you for today's class. It is about your anatomy and physiology. We are still continue to the skeletal system, the spinal column. As we discussed earlier in the class about the lumbar spine, L5, largest vertebra in the body, which has to support the upper body weight. So today's component which we are going to discuss is your after the lumbar spine. Spinal or vertebral column. So today we are going to talk about the sacrum. So sacrum is just after the lumbar spine. Some people consider it as a one bone because it is fused. Some people consider it as a 5 bone too. So S5 fused vertebrae. S5 fused vertebrae. So basically the main function of the sacrum is for stability. It provides stability to the pelvis. So sacrum provides stability to the pelvis. If we go through into the more detail about the sacrum here, so as we look at the skeletal system here now, once again. So here we have discussed about the lumbar spine yesterday. L5, right? L1, L2, L3, L4, L5. So L1, L2, L3, L4, L5. This is the fused one if you look at here now. 1, 2, 3, 4, 5. This is fused one. It is your sacrum. So sacrum 5 fused. Now you can see that the sacrum, this is the 5 fused vertebrae, right? It provides stability to the pelvis. So on the side you have a hip bone. So guys, this is basically what happens here. It connects with the ligaments, right? It connects with the ligaments to the pelvis. So whenever you try to overstretch, whenever you try to get, mostly when we have a stiffness in our hamstring muscles, right? If we have a stiffness in our hamstring muscles, so problem occurs in that way, like problem in the hamstrings, right? You're trying to stretch, and extra pressure comes here. So basically people say that the ligament get overstretched sometimes. So ligament hairs, right? That is originating from the sacrum connecting to the pelvis here. So sometimes due to extra stress on your lower back or tightness in your hamstring muscles, so these muscles not allow you to stretch more. So you're trying to put here. You try to do this with the beginners. As you try to do this, what happened? The ligament from here get overstretched. And then people complain that the back pain persists for the longer duration of time. So what's the reason behind that? Same thing happens sometime you're trying to throw your pelvis forward and compression on your ligaments, on the SI joint too. So people complain that this pain persists for the longer duration of time. So have you ever think that what is the reason behind that? This pain, why does it persist for the longer duration of time? Muscular pain, if you have 2 days, 3 days, 5 days, it's gone. Ligament injury, as we say, takes long time to heal. So what is the reason behind that? That ligament injury, why does it take long time to heal? So reason behind that is that the ligament has poor blood supply, right? The ligament has poor blood circulation. That's why it takes long time to heal. So guys, that's why we say that if you are trying to go with the forward bending with the beginners, you never ask them to do this, try to touch your toes with this jerks. No. If you have a problem with the hamstring, bend your knees, go easily. So there is no stress on your sacrum area. Now people ask that, okay, I'm doing sitting job for 5 to 6 hours a day. Standing jobs, I have pressure on my lower back. How to release it? So simple way if you want to release that sacrum, the simple exercise you can practice, you just go for the knee to chest, right? Knee to chest. Just bend your knee towards your chest and hold your thigh and just try to stretch it. Hold it for 20 to 30 seconds, 3 to 5 repetitions. So here we go, knee to chest. This is the one thing you can do. And release the pressure from your sacral area. If you want to strengthen these muscles slightly, pelvic half bridge you can do. And then release. Pelvic half bridge. And then release. So this pelvic half bridge you can do 20 to 30 seconds. And then release. So as you get time in between, just try to release the pressure from the sacrum. Try to do this. Knee to chest. Not extra pressure on your abdominals. If you won't feel like that, just bring your thigh out and try to touch your chest. So this is the way you can release a simple exercise to release the pressure from your sacral area. So this is sacrum S5 fused vertebrae that we have discussed earlier. That is S5 fused vertebrae. So after the sacrum, guys, mostly the injuries that happens in the yoga or in other field too, most of the injuries happens here because we don't have an awareness on the sacral area. And in the side, there is sacroiliac joint too. In the side, this is the sacroiliac joint. This is sacrum, and where the iliac bone of the hip bone connects, here it forms the sacroiliac joint. This area, right? This area is the sacroiliac joint. And this joint has very subtle movement, very subtle mobility here, very subtle movement. And if you're trying to overforce this joint, again same problem happens. There is sprain to the ligaments. Overstretching, then again takes long time to heal. As we have discussed, ligament has poor blood supply. So stabilize your sacrum in which poses you need. Like if you're going for the backward bending, it has to be stabilized. No need to throw forward. No need to throw your pelvis forward. If you're going for the forward bending here, easily if you feel tightness on my lower back and on my hamstring, bend your knees, bring your stomach towards your thighs and then try to touch the floor. So no extra pressure on your sacroiliac joint and sacral area. So I hope this must be clear to you. The sacrum, S5 fused vertebrae that provide stability to the pelvis and also provide stability to the upper body. It also bear the weight of your upper body, the upper vertebrae too. After the sacrum, we have a coccyx. That we call the tailbone. CX for coccyx, CX, 4 fused vertebrae. The coccyx, 4 fused vertebrae here. So coccyx, we have tailbone, which we say 4 fused vertebrae together like sacrum. So it is on the base of the spine that forms the base part of the spine, the coccyx 4 fused vertebrae. If you look at here now, the coccyx 4 fused vertebrae, this is the tail. After the sacrum, this is the tail. If you see 1, 2, 3, 4, right? So these are the 4 fused coccyx that we say on the base of the sacrum, on the base of the spine, the coccyx 4 fused vertebrae, right? So this is after the sacrum we have coccyx. So now people ask that what is the role of the coccyx in your spine? Basically there is not as such role of the coccyx in your spine. It is because of the evolution, right? Because of our ancestors. They had a tail outside, we have an inside, and the small tail, which we say. So the tailbone basically, it is not that much big that can give you the support. It cannot that much strong enough that can bear the body weight when you fall down. So sometime when you fall down on your back or you fall from any height, there is a fracture on your tailbone. And that tailbone fracture, it hurts a lot. Because this is the bone, when you try to sit, the whole pressure comes to this bone too. Or if there is any fracture, and the nerve sensitivity, right, the nerve sensitivity around this area is more. So as the pain carries more after the broken bone, so that's why we say that when you try to use the command, sometime in your classes like tuck your tailbone in, tuck your tailbone in, tuck your tailbone in, we don't have to overpressure the bone, guys. The bone is for the stability, not for that much mobility. We have to use the muscle around it or the muscle which are weaker to control the movement of the pelvis so that you could not force the tailbone. So try to change the command. We don't have to use tuck your tailbone in, tuck your tailbone in. We have to use the muscle because muscle is for the movement. For more movement, what we need? Muscle control. We don't need to control on the bone. Bone is for the stability more. So try to change the command as simple as it is, right? So we don't have to use tuck your tailbone in like in the chair pose. No, this is wrong. If you're going into the chair pose and you're trying to press it here, this is going on. How much pressure you are creating here, and your glutes get over contracted. The other muscles get over contracted and maybe the compression on your nerve. So it has to be simple to control the bone, to control the pelvic, just try to push your navel towards the spine. So the movement has to be more synchronized. It has not to be just by force. Over force you are getting into the one isolated area. That is wrong. Just use the muscle and feel the synchronization of the movement with muscle control and with bone control. So I hope this must be clear to you. So this is what we have discussed about the whole spinal column from cervical to the coccyx. So as we go through quickly to the whole spinal column, so cervical C7, that is your T time. Thoracic 12, lunchtime, just to remember easily. Lumbar 5, snacks or early dinner. Then we can say sacrum 5 plus coccyx 4. How many? 9. So 9 is your late dinner. So this is the way you can easily remember it. The number of vertebrae in each component. Cervical 7, thoracic 12, lumbar 5, sacrum 5 plus coccyx 4 is equal to 9. So this is the one mnemonics you can use in relation to your activity of daily living, so you can remember about your numbers and the components, how much number they have in each categories. So I hope this is clear to you guys, that cervical, thoracic, lumbar, sacrum and coccyx. Any question related to the spinal injuries, any question related to the spinal pain, you can ask us anytime. You are most welcome. So thank you so much for today's class for sacrum and coccyx. Namaste. Have a nice day.